or an amended amount. Or an amended amount. Well, if it pleases committee, let's go ahead and kind of get the bill to where we need it to be considered. Have you got the amendments, Representative? I do, as well as the abatements style amendment. Okay. Should be it was in my packet there. Okay. I'll go ahead and offer the amendment, if you will, if it pleases the committee. The First Amendment, basically, and Representative Collins had already been working with our cities and our counties' ability to opt in or opt out of this, depending on whether they want to participate in the program. Over the last 24 hours, continue to work with the bill sponsor. We have expanded that to also abate the state portion. In other words, once this bill passes, it'll be in place, but will only go into effect if that local city or county adopts the bill. And we're giving that authority to that local entity to abate the state side as well. And so it would not apply to anyone once we approve or disapprove the bill, of course. But I think that just gives more control to the locals, and I think it's always a good thing. So with that said, replace line 5 on page 1 with the following. This bill will allow local governments to exempt certain aircraft and replace line 13 on page 1 with the following. Relating to taxation to allow local governments to exempt certain general. Replace lines 17 through 19 on page 1 with the following. Beginning on October 1, 2026, any county or municipality by resolution or ordinance may exempt general aviation aircraft and any machinery or equipment to be installed on these aircraft from state, county, or municipal ad valorem taxes. The ordinance of resolution must be adopted at least 90 days prior to October 1 of the electing year. Replace line 30 on page 2 with the following. Section 2, this act shall become effective on May. Replace line 29 on page 2 with the following. Implementation and administration of this act. And then notwithstanding any other provision of this section, any exemption granted pursuant to this section shall cease no later than 30th, 2029. And that prevents any overlap there, and that would sunset this on September 30th.
Mr. Chairman, if I may ask a question.
Yes, sir.
So on that, so the counties and cities can opt in for the state portion in their area as well. If a county was to do it, does that cover all the cities in the county as well if they do it on the state side and the county side?
It's my understanding, and I'll
logistically
ask the fiscal office that they would have to opt in as well.
For the state
cities.
portion.
Yep.
So if the county opted in for the state cut, I guess all the cities then would cut the state side within the county. The county can.
That's correct, because there's separate line items in the appropriation, and it's local, county, schools, and state.
Yes. Okay.
Yes, sir.
Yep. I find that favorable. Thank you.
Any questions on the amendments? Do I have a motion to accept the amendment? Move. Second. Second. All in favor say aye. All opposed? Okay. The bill has been amended. Now we're back on the regular bill for discussion. Okay. Oh, I thought it was one amendment. Thank you, Ms. Harper. Okay, on the second amendment related to the sunset, have a motion, second. All in favor say aye. Aye. Opposed? We have both amendments adopted. Back on the bill, HB 185, any discussion or questions? Silent body sounds like you're ready to vote. All in favor say aye. Do I have a motion?
Get a motion? Yeah.
You have a motion. Do I have a second? Second. All in favor say aye. Oppose? Your reel fails.
Thank you, Mr. Chairman.
Thank you, Ms. All right, next bill, Ms. Collins. Ms. Harper?
Senate Bill 28 by Senator Elliott. Retired state employees work as law enforcement officer or assistant district attorney authorized.
Senator Elliott here? Okay, he's tied up. Let's move to the next bill, Ms. Harper.
Okay, House Bill 400 by Representative Oliver, ground ambulance services to prohibit balance billing and set minimum reimbursement rates for health care issuers to emergency medical service providers.
Chairman Oliver.
Mr. Speaker, as the title suggests, emergency medical services reimbursement rates, first of all, establishes a minimum EMS transport reimbursement rate in-network and out-of-network for EMS transport service providers. Bases that reimbursement rate off the CMS Super Rural add-on for the rural zip code, which is 35462 Green County. The rate will apply uniformly on a statewide basis. Treat in place, which is one of the things this bill establishes, allows EMS service providers to treat low acuity patients instead of transport. We believe that will save us an awful lot of money as we move forward. Balance billing. An EMS provider may not balance bill for any amount except for an enrollee's deductible, co-insurance deductible, or other amounts covered by an enrollee's health care benefit plan. That means that the ambulance company sends you a completely separate bill after your insurance settles. Data collection. This is going to be a study, so we need to collect data. EMS providers shall submit annually to the Alabama Department of Public Health, and we're going to do that through a third party, a report of the information set out in the substitute bill. Actuarial study, ADPA shall contract with the consultant, and we've got other language to take care of that. Cost of the study, not to exceed, we said $50,000, but we really don't know, but that's what we're estimating, and be paid for by the largest health insurers in the state. The report will be submitted to the President Pro Tem and the Speaker no later than December 1st, 2028, and this bill shall sunset on June 1st, 2029, to allow parties to review the actuarial report and determine if changes need to be made. And with that, Mr. Chairman, would like to ask the other people to have the opportunity to come speak on this.
Okay, do you have a sub? Let's go ahead and adopt the sub.
Right, I do have some,
Well,
I don't
that
have copies,
substitute was adopted in health, so that's what's in front of you.
Okay, very good. So on the sub, do you have an amendment to the
I
sub?
do.
Okay, go ahead with your amendment.
First amendment to replace line 11 on page 1 with the following. Ambulance services with exceptions to provide the established. Replace lines 16 through 17 on page 1 with the following. Public health to provide for a report on the
It's
effects.
all in the same one. It's all the same.
Replace line 63 on page 3 with the following. 10, healthcare benefit plan. A, the term includes any individual or group. Replace line 72 on page 3 with the following. Medicaid. B, the term does not include any plan that pays or reimburses for healthcare services, including those provided by an emergency medical service provider pursuant to Chapter 25A of Title 16, Code of Alabama, 1975, or Chapter 29 of Title 36, Code of Alabama, 1975. Replace line 92 on page 4 with the following. Enrollee and renders basic life support. Replace lines 237 through 239 on page 9 with the following. Section 5A, the Alabama Association of Ambulance Services shall contract with a business school accredited by the association to advance collegiate schools of business located at a doctoral granting regional institution with research college and university Carnegie classification status, which has expertise in risk management and insurance to study the impact of.
All right, any questions on the amendment to the sub?
I do, Mr. Chairman.
Leader Lee?
Explain to me what Section 5 means exactly. I mean, this was put in after it left us in the Health Committee.
What that is, there were some contractual challenges in having ADPH actually do the study, so we got a third party, which is
So really, all you're doing that for is to see the results, not necessarily, has nothing to do with the work out in the field. Okay. Thank you.
Any other questions?
And this amendment also, based on the statute, exempts SEIB and PHIP plans from the legislation, correct? Okay. Any other questions by the committee? Representative Mooney?
I'm going to be dead honest and just say, I represent citizens, whether they are in PHIP or whatever program we have in the state. All of my citizens do not have that. We have had more mandate bills come through in 13 days than I can remember any time in the 12 years I've been serving. I love our rural ambulance people and the things we've done in Shelby County to provide them with ambulances and give them to them to make things better, do whatever we can. But I can't in good conscience not ask the question, are the people that we represent who elect us and put us in office, are we not going to be concerned about what the effect this is going to have on their health care costs?
Absolutely.
This is going to increase their health care costs. Fundamentally, it cannot not increase them.
Well, you've got a couple of people that are going to testify that will tell you it will, and you've got a couple of things that won't. What we're trying to do is save ambulance time and keep people from being transported that don't need to be transported.
And I love that portion of it. The transfer of the cost to the insured is what I have a significant issue with in that. And, you know, I love you, Ed. You're a great friend. We're right across the hall from each other, and we talk all the time. And I wish I had been able to get to health last week. I had a problem and a car overheated on the highway. But I've got more people at home asking me questions about this than they're asking more questions about it than most of the stuff that has been in the news and whatever about other stuff, because they are well-educated people in my district, and they understand when they see mandates coming what it's going to mean to their health care costs.
The question's fair. Understand the purpose of this is to actually save money.
And then therefore do the study as well to back that up. Any other questions before we move into a public hearing?
Thank you.
Thank you, Representative Oliver. I'm sorry. Yes. Do you have a motion on the amendment?
Motion.
Have a motion, second? Second. All in favor, say aye.
Aye.
Opposed? Okay, we're now adopting back on the bill, and we'll move into the public hearing for HB 400. I'll ask both the proponents and the opponents, keep it to about 3 minutes if we will. We've got 6 speakers. So the first will be on the proponents will be Stephen Wilson. Welcome, Mr. Wilson.
Thank you, Mr. Chair. Thank you, members of the committee. I appreciate the opportunity I had today to address you all about this matter. Myself, I'm a paramedic. I have worked in the field. I am the current director of operations for Haynes Ambulance Service of Alabama, which is based here in Montgomery. I'm also an former state EMS director for the Department of Public Health, and I worked for the Department of Public Health for 13 years. I've also worked at the national level for the National Registry of EMTs as a certification body across the United States. So I've seen EMS from a lot of different perspectives in my career. Currently in the private EMS setting, we, Haynes Ambulance, serve rural and urban areas. This bill will help with our rural health care crisis. Some of the rural communities we serve are Bullock, Crenshaw, Macon, and Lowndes. 2 of those counties don't even have a hospital in them. So therefore, we become the frontline healthcare provider in those counties. Lowndes County this morning, this is real life today. I didn't even have a crew available in Lowndes County for a while. I had to send a crew out of Montgomery because we were unable to staff that truck this morning. So I had to send a truck from the city of Montgomery out to Lowndes County just to staff that ambulance to make sure they had EMS coverage. This bill will help by addressing the massive shortage of EMS personnel we have. We are grossly underpaid in EMS. Our providers that are out there do not make competitive wages. This bill will help with those competitive wages. It'll also help with the much needed equipment that we need. to serve and take care of these patients. I have one more story for you, and I'll leave you with that. And that was last night. That was a wreck in rural Montgomery County, out in the Grady area. Some of you may be familiar with that area. We didn't have an ambulance available immediately when that call came out. I was at home. I live about 20 minutes from that area, so I jumped in my supervisor vehicle, and I went out to try to help this wreck victim before the ambulance got there. But if we had better funding and we could hire more employees, we could educate them better, and we could put better equipment in the field for to take care of our patients. But again, I thank you for your time, and
Thank you, Mr. Wilson.
yes, sir.
Any questions? Move to an opponent, Sid Phelps. Welcome, Mr. Phelps.
Thank you, Mr. Chairman. Thank you, committee, for having me this afternoon. First off, I'd like to thank all of you for your support last year in pushing through the Alpha Health Plan. It made a big impact for me. As a self-employed business owner, insurance is one of my largest annual expenses. Having affordable, competitive options is something that we all depend on in managing our budgets as self-employed business operators. And because of the health plan, I was able to shop my rates across the board, and I went with a hybrid program. So it allowed me to stay with my existing provider, also use the Alpha Health Plan, resulted in about a 25% savings for me personally. This not only improved my bottom line, but increased my coverage benefits to be better covered in the case of something to happen. I respect Mr. Oliver and everything that he does. I respect the EMS workers, and we have got to have great service in our communities for health insurance, health services. And I think there may be some other ways that we could approach this issue besides a statewide mandate. Having experience with mandates and insurance has not always been positive for me. As I said before, I'm a self-business person. My business operates in the trucking industry. Mandates and regulations have caused incredible increases in our cost. Trucking companies are required to carry a mandated minimum liability amount, and we often see aggressive advertisings of the "Have you been injured? Call us now." These campaigns drive excessive claims and litigation. Over time, this has caused my insurance rates to skyrocket. Today, my insurance is my third highest on that end of all of my business, next to my labor and fuel expenses. I'd like to make one point. When prices are fixed or mandated, the cost is ultimately passed down to the consumer, as Representative Mooney said. I respectfully, would like to consider alternate solutions where the EMS workers can definitely get their wage, because without them, we have a major safety net. But I think there's potential opportunity that we could look at collectively as a body to ensure that our citizens are safe, taken care of, and that those staff members in EMS are protected and paid a very well wage. I appreciate your time this afternoon.
Thank you, Mr. Phelps. Did you have a question, Ms. Hall? Mr. Phelps, hold on a second.
Are you able to share what type of recommendations you're thinking?
Representative Hall, I'm not sure on this. I think there's different ways. I'm not as well educated in the medical industry and what it takes to do that, but I also understand there's got to be some solutions there. As they mentioned the treat in place. I think that's something you can see a lot of, especially if you've got to transport a personnel to hospital and have to wait. If the doctors can't see them, the EMS workers have to stay there and hold them when they may need to go get another service call. So I think there's some different opportunities they can look at, but what's needed specifically maybe in Birmingham is going to be different than rural Bullitt County or rural Russell County. I think that's why I say the statewide mandate may not be necessary when you can get resources in some metropolitan areas, when this is probably going to be a more rural issue.
Thank you.
Yes, ma'am.
Any other questions? Remaining on the proponents, Vicki McElroy. Welcome.
Hello, Chairman, Committee. Thank y'all for the opportunity to be here. I'm Vicki McCrory. I'm a paramedic. I've been in Pickens County for 36 years on the ambulance. I was manager there for probably 28 of those years. I'm here to put the human element on all this. I see how important this can be, because It's happening every day. Somebody's using the ambulance for something that's not necessary. And in Pickens County's situation, without a hospital, we're an hour away if we transport to Tuscaloosa from Aliceville. So I kind of want to give y'all a little bit of perspective. And if you don't mind, can we just do a small, quick exercise? I would like everybody just to take a real big, deep breath, real big one. Now hold it. And hold it, and hold it as long as you can. Now imagine having to do that for an hour and 15 minutes while we're taking somebody who has chronic back pain 50 miles away to another hospital to get pain meds. He could have, if this bill was in place at that time, he could have been treated at home. We could have gotten to the person who basically drowned on his own fluids. He's 56 years old. It's Christmas night. His family's home visiting from out of state. He has a 14-year-old and an 8-year-old. His wife passed away 5 years ago. His kids watch him take his last breath because it took us an hour and 15 minutes to get there, unnecessarily, in my opinion. There was no fire department, no helicopter. There was nobody to come help this man. And that affected me greatly. And I feel like sometimes we're kind of off in a world of our own in the rural areas with no hospital and sometimes third world type healthcare situations. But I think this bill would be tremendous because there's a lot of people that like to call the ambulance unnecessarily that can be treated at home and keep services inside the county, the resources inside the county when it's needed.
Thank you, Ms. McCrory. Any questions? Thank you. Eric Penley.
Thank you, Mr. Chairman, committee. I'm Eric Penley, the president of Alabama Ambulance Association. About 4 years ago, we kind of ignited this association. We got over 100 ambulance services in our association because we just got to a point it was beyond us to fix the issues we have. Stories like Vicky and Stephen, they're all over there every day, even in Jefferson County, an area I serve, and we see there's 911 calls and you get no ambulance available, or you got 45-minute, extended response times. And we can say it's rural, it's in urban areas, it's all over the state. And, talking about the reimbursement rates, number one, we're one of the lowest in the country at 140% of CMS Medicare rates. We've got a neighboring state in Mississippi that is at 325% of CMS Medicare rates. We are losing paramedics and EMTs on the west side of Alabama going to Mississippi to work. We've had 17 states. I sit on the American Ambulance Association State Association leadership row, and we've got 17 states that's passed this legislation at 325% or higher. We got Georgia right now. It's got that on the floor for 400%. We tried that 2 or 3 years ago. You guys we've tried to turn over every stone and trying to figure out different ways that we can find to put more ambulances in these communities, get more EMTs. And I've been doing this 30 years, and I think you guys have seen this a lot the last 4 years. If there's other ideas of how to get funding or to fix this, I'm all open. But we first started with the Medicaid provider tax that you guys helped us with 3 years ago. That made a difference, made Medicaid payments go up from $200 to around $500. We've been working with the governor's office with SHPTA on the Rural Health Transformation Program with the treat in place and workforce development. I think we got some funding coming with that we're going to be working with on that as well. But, the reimbursement rate, we started at $325, 2 or 3 years ago. It was recommended that we get with the insurers and find a happy medium, and we've done that. This rate's going to be about 250%. Still probably going to be the lower third of the country, but at least we're going to do a study and let's see what it did in these areas. Did it put more trucks? Did it reduce response time? Did it save lives? That's sad on Christmas Day to hear that and see that and experience that. That's why I wanted Vicky to come. And sometimes we could talk about money and cost and everything, but that's real life stuff. It's happening every day in Alabama. And in your areas, you probably heard that from some of your constituents. There's no ambulance available or long extended response times. They did a study, it's called Ambulance Deserts. We're second in the country in rural areas. So that's 25 minutes or further away, I guess, for the closest ambulance. We're second in the country with that. CMS, the Center of Medicaid, Medicare just released a study. They've been doing it for 4 years, 7,300 ambulance services across the country, a lot of those from Alabama. It was released December of 25. And it's a pretty extensive study we did, digging into your finances, your cost, how much does it cost? The lowest average cost is $1,100 for an ambulance call. And you think, how, that's pretty expensive. Well, the 3 or 4 hours they're sitting there not running a call, payroll's still rolling, lights are still running. So, the costs are still accruing. So we're not even close to that. So what do services do here in Alabama? They cut services to get inside their budget. So that's why we think it's very important that we get a reimbursement rate that's set. It's set one way or the other. It's not a mandate one way or the other. That's what the percentage is. At least we're doing a study to see what it is, and we can come back.
Thank you, Mr. Penley.
Thank you so
Appreciate it.
much.
Yes, sir. Question.
Yes, sir. Your report from CMS, does it say that it need more funding?
Yes, and with this, they are recommending that the states do their own legislation and still doing a federal mandate because ambulance services was left out of the No Surprise Billing Act.
Right. So we know that CMS sets the basis of where you paid from, correct? So have they come up any in the last few years, or what's the reimbursement rate done in the last few years from CMS?
Medicare, like we get an ambulance inflation factor every year, just an increase with that. Medicare has identified that it's like 325% of their CMS rate would cover the cost, but Medicare has not went up. So, and one thing with our Medicaid provider tax we have is set to the average commercial rate, so that will help also in Alabama.
Yeah, it's interesting to me. Federal government says, "Hey, we're not paying you enough money, but we're not going to do anything about it." That's interesting.
Sir.
Thank you.
Thank you, Mr. Penley. Appreciate it.
Thank you.
Sonny Brassfield. Welcome, sir.
Thank you, Mr. Chairman, members of the committee. Let's talk about treating place, 75 cents, balance billing, and investing or spending. Treating place. There is no provision for reimbursement for ambulance services that come to my in-laws' house in Heflin when my 90-year-old father-in-law has chest pains. They hook him up, they check him, they talk to his doctor, they don't transport him, and they go back and reset the ambulance. They don't get a penny for that. There's no provision for payment. This bill changes that. And in my opinion, that's investing, not spending. It's trying to use our resources better, and it's ensuring that there is reimbursement for that expense. 75 cents. Almost 60 Alabama counties participate in the local government health insurance program here in Alabama, more than 300 cities. It is the only public entity health insurance program that was not exempted by the amendment that you adopted. And we're not here seeking an exemption. We're here supporting this legislation. This year, our premium is about $400 million. And the folks who run the operation estimate that this bill would cost between $500,000 and $600,000. That's less than 2/10 of 1 penny. There are about 65,000 participants in the local government program. That's 76 cents a month is what the increase in premium would be for the improvements that this legislation puts together for the people that you represent. 76 cents a month. It's worth that investment for us to be able to move forward. And I encourage this committee to look hard at finding a way to keeping all providers in this program so that all of your constituents can benefit from what this bill does. And finally, Mr. Chairman, one of the things this bill does is prohibit balance billing. If you don't live in this process every day, you don't know what that means. What that means is after you've paid your copay and your insurance has paid that benefit, balance billing means that the ambulance provider can come back and come after you for the delta, for the part that's left unpaid. This bill puts in Alabama law that with the increases in the mandate, with that comes protection for the people in your district that once they've paid their copay and the insurance has paid its required amount, then they can't come back against the people in your district for that additional amount of money. The funds you have exempted will not, the people that pay premiums in those funds will not be protected by the balance billing provisions of this bill. I encourage this committee to move forward. It's not very often that we stand before you and say, let's do a mandate. That should tell you what kind of crisis we believe we're in. Mr. Chairman, thank you.
Thank you, Mr. Russell. Next, Kimberly Trotter. Thank you. Okay. Thank you, Mr. Leader. Welcome.
Thanks for having me. I'm going to give you a different perspective, perhaps, than you've heard. My name's Kimberly Trotter. I'm the mayor of Rehoboth, Alabama, which is a very small town on the outskirts of Dothan in southeast Houston County. We have an ambulance provider within a department of our town, and we provide a lot of the ambulance service for southeast Houston County. Most of the unincorporated areas, that's what we cover. And so I'm here today to urge you to think of not only is this a rural healthcare solution, but also the domino effect that this solution helps. There are two very large hospitals located within my county in the city of Dothan, which is constantly on diversion. And one of those reasons is because of the transports that some of our ambulance providers in the county are doing. We are receiving patients from Colvin County, from Geneva County, into Houston County. And so two very, very large hospitals are on diversion for this reason. Transport in place will prevent a lot of this from happening. If our EMS providers do not feel that they have to transport a patient, that clears up space in our ERs, it clears up space in our hospital. But unfortunately, the way this has been set up over time is they do feel like every little medical emergency has to be transported to be able to pay for their services. Right now, if you have a medical emergency and you're a diabetic, you know you're a diabetic. Your sugar bottom's out. My providers are going to show up. They're going to start an IV on you, and you're more than likely going to say, this happens periodically. I don't want to go to the hospital for this. I'm out of fuel. I'm out of labor. I'm out of all the supplies that has been used to give this patient the care they provide, and there's no provision for me to bill for that service. This fixes those issues. It's going to free up funding for a lot of our providers so mine is a public EMS provider. It's going to free up us funding for more supplies, more employees, more equipment, and ambulances, several $100,000 out these days, as you know. And it's going to allow me to add shifts so that there are quicker response times all around that southern part of the county, particularly in my area. So I urge you to think of that it's not just a rural healthcare issue. It definitely has a domino effect down the road of every other larger city that might be the receiving end of some of these rural healthcare providers.
Very good. Any questions? Thank you. Any other questions for Chairman Oliver? Is he still here? Chairman, any other questions? If not, we'll carry it over and it will be on the agenda for vote next week. Yes, sir. Thank you. Next bill, Ms. Harper. Please.
Senate Bill 28 by Senator Elliott, retired state employees work as law enforcement officer or assistant district attorney authorized.
Senator Elliott, welcome.
Thank you, sir, and thanks for your indulgence with me not being here when you called me the first time.
Yes, sir, no problem.
Here was in another committee, Chairman Ingram's committee. Members, this is a return to work bill that is fairly inclusive. So it's going to deal with law enforcement, state troopers, your police officers, your campus police officers, sheriff's deputies, et cetera. It also deals with district attorneys, and then separately and independently deals with school bus drivers. And so y'all have seen a similar bill on your floor that you passed already that deals with school bus drivers, and this encompasses that as well. And so what it simply does is it moves that return to work limit that we're also familiar with up to $52,000. We're trying to solve a problem here, and that's getting law enforcement folks that we have spent a lot of time, energy, effort, and money training, equipping to continue to service. The same thing with district attorneys. And then the bus drivers are a little bit different. Currently, if they're part-time, they're not hitting that income limit necessarily, but if they're coming back to work after already being retired, they're only allowed to drive a certain number of routes. Even if they could continue to drive and want to continue to drive, they have to be classified as part-time. And again, not hitting an income cap limit there at all. But we've got bus driver shortages almost everywhere that I'm aware of. And so it allows retirees to come back and drive the full routes. And so that's the bill, Mr.
Very
Chairman.
good. You want to go ahead and explain your sub?
Well, that essentially, that was the general of the bill, yes, sir. And then the sub itself did a lot of things Chairman Orr wanted to do upstairs to protect our budget.
I've been through those years.
Yes, sir, we all have. And so he's basically, the short answer is his intention was basically to phase this in. And so currently you can retire with 25 years. He's saying first year you can have 25 years and then return to work. Second year you have to go 26 years before you can come back to work. Third year you have to work 27 years before this kicks in. And so his thought there is this would not further encourage folks to retire right at 25 years and then come right back. Honestly, I didn't love it, but sometimes we have to compromise to get done what we want done.
Any questions about the sub? Entertain a motion. Have a motion. Second. All in favor say aye. Opposed? Okay, we've adopted the sub, and I believe you have an amendment to the sub.
That's correct. And so there we are.
Representative Witt.
Take care of this, certainly for my friend. Replace line 115 on page 5 with the following. This is already there. Municipal police officer. F, a law enforcement officer as defined in 36-27-59. G, a state policeman as defined in section 36-27-1.
Very good. Any questions about the amendment to the sub? Have a motion? Second. All in favor say aye. Opposed? Okay, we have adopted the amended sub and back on the bill. Any questions for Senator Elliott on the bill? I have a motion. I have a second. All in favor say aye. Opposed? Bill received a favorable report. Thanks, sir.
Thank you, Mr. Chairman. Thank you,
Appreciate
members.
it. All right, next bill, Ms. Harper.
Senate Bill 155 by Senator Woods, Coal-Impacted Communities Economic and Workforce Development Grant Programs established, new fund created, distribution of rent and royalties of federal coal lease sales.
Thank you. Welcome, Senator Woods. And we have, committee, just as a reminder, we've already passed this piece of legislation, Representative Brinyard, but we will need, for purposes of this committee, go ahead and adopt the amendment. Yes, sir. Very good. Go ahead and offer the amendment.
I have the amendment.
Representative Underwood.
Thanks, sir. Replace line 178 on page 7 with the following. Contrary, beginning January 1, 2027 and ending December 31, 2030, the revenues derived from the payment of rent and then replace line 180 on page 7 with the following. After January 1, 2027 shall be distributed annually as follows.
Is that a question? Okay, as correct.
A lot to be said here.
I'd have a motion on the amendment. Motion, second? Second, all in favor say aye. Opposed? All right, we have SB 155 as amended. Do I have a motion? Motion, second, all in favor say aye. Opposed? Bill receives a favorable report.
Thank you, Mr. Chairman.
Yes,
Thank
sir.
you, committee. Appreciate you.
All right, Ms. Harper, let's recall, if it pleases the committee, HB 312 at the call of the chair, Jim Hill's bill. And Representative Sales, I believe you have an amendment to that piece of legislation?
Yes, it's in front of you.
Yeah.
It's in a separate paperclip.
Go ahead, Representative Sales. On the amendment to HB 312.
Yes, Mr. Chairman. This amendment, doesn't it simply just go from the last 3 years to 5 years?
Well, I think as the bill was proposed, it was at the highest 1 year.
Right.
And we are amending that back to 5 years.
5 years, that's right.
Yes, sir.
Let me read it.
If you would, just
Okay.
go through it.
Okay, replace line 11 through 14 on page 1 with the following. This bill will revise the percentage of second, replace line 20 on page 1 with the following. This bill would also provide for the service. Line 11, replace line 15 through 27, page 1. Line 13 says replace lines 35 through 38 on page 2 with the following. Under the Judicial Retirement Fund to amend sections 12-17-227.4 and 12-17-227.5 Code of Alabama 1975-2. Replace line 40 on page 2 with the following. Used for determining a member's pension and to revise the maximum. Replace on line 42 through 44 on page 2 with the following. Retirement allowance. Replace on line 46 through 47 on page 2 with the following. Section 1, sections 12-17-227-4 and 12-17-227 period .5 of the Code of Alabama 1975R. Replace on line 47 through line 140. Replace on line 49 through 106 on page 2 through 4 with the following. Section 2-17-227.4. Replace on line 181 through 244 on page 7 through 9 with the following. Section 2, this act shall become effective on October.
Thank you, members. This basically pulls that bill back in alignment with the Tier 2 provision for 5% for the highest of 5 years. Any other questions on the bill before we take a motion? I have a motion and a second. Second. All in favor say aye.
Aye.
Opposed? Okay, bill receives a favorable report. Oh, that was amendment, excuse me. Now, back on HB 312 as amended. Do I have a motion? Have a motion? Second? All in favor say aye. Opposed? Bill receives a favorable report.
Thank you, Mr. Chairman.
Thank you much. I'll entertain a motion to adjourn. So moved. I told you it was going to be a difficult committee meeting today. Thank y'all for hanging in there.